A scene opens with a serene image of healthy lungs gently expanding and contracting. A hello and welcome. Today, we're delving into a complex and often overlooked lung condition: drug-induced interstitial lung disease, or DILD. This is a serious condition where medications, intended to heal, ironically damage the lungs, leading to inflammation and scarring. Join us as we unravel the intricacies of DILD, exploring its causes, symptoms, diagnosis, and potential treatments. A scene transitions to an animation depicting various medications entering the body, with some highlighting in red to indicate potential offenders. So, what exactly causes drug-induced interstitial lung disease? The etiology is diverse, as many medications have been implicated. Chemotherapy drugs such as bleomycin and methotrexate are well-known culprits. Certain antibiotics, particularly nitrofurantoin and sulfasalazine, have also been linked. Antiarrhythmic medications like amiodarone, and even some biologic therapies used to treat rheumatoid arthritis and other autoimmune diseases, can trigger DILD. The exact mechanism by which these drugs cause lung damage is complex and not fully understood, but it involves an inflammatory response that leads to scarring of the lung tissue. A scene moves to a detailed animation of lung alveoli, showing inflammation and fibrosis. Let's dive deeper into the pathophysiology. DILD begins with an inflammatory response within the lung tissue, specifically the alveoli and the interstitial space, the area between the air sacs. This inflammation is often triggered by the drug itself or by its metabolites. Over time, this chronic inflammation leads to fibrosis, the formation of scar tissue. This scarring thickens the alveolar walls, making it difficult for oxygen to pass from the lungs into the bloodstream. Consequently, the lungs become less compliant, and breathing becomes labored. The extent of lung damage can vary greatly depending on the drug dosage, duration of exposure, and individual patient factors. A scene displays an infographic showing statistical data related to DILD incidence and prevalence. Understanding the epidemiology of DILD is challenging, as it's often underdiagnosed and can mimic other lung conditions. Accurately determining its true incidence is difficult. However, it's estimated that DILD accounts for a significant percentage of all interstitial lung diseases. Certain populations, such as older adults, those with pre-existing lung conditions, and individuals taking multiple medications, may be at higher risk. It's also important to note that the incidence may be increasing as new medications are developed and more individuals are exposed to potentially offending drugs. A scene shifts to a visual representation of someone experiencing common DILD symptoms. Recognizing the signs and symptoms of DILD is crucial for early diagnosis and intervention. The most common symptom is shortness of breath, particularly with exertion. A dry cough is also frequently reported. Other potential symptoms include fatigue, chest pain, and unintended weight loss. In severe cases, patients may experience cyanosis, a bluish discoloration of the skin due to low oxygen levels in the blood. It's important to remember that these symptoms can be similar to those of other respiratory illnesses, making it essential to consider the patient's medication history. A scene illustrates the diagnostic process, showing chest X-rays, CT scans, and possibly a lung biopsy. Diagnosing DILD involves a comprehensive evaluation. The first step is a thorough review of the patient's medical history, paying close attention to all medications they are taking. A physical examination, including listening to the lungs for abnormal sounds, is also essential. Imaging studies, such as chest X-rays and high-resolution CT scans, are crucial for visualizing the lung tissue and identifying patterns of inflammation and fibrosis. Pulmonary function tests, which measure lung capacity and airflow, can help assess the severity of the lung damage. In some cases, a lung biopsy may be necessary to confirm the diagnosis and rule out other causes of interstitial lung disease. A scene that there are no well-defined classifications or types to show. A drug-induced interstitial lung disease does not have universally accepted classifications or types in the same way as some other ILDs. However, it is sometimes categorized based on the pattern of lung injury observed on imaging or biopsy. These patterns can include organizing pneumonia, diffuse alveolar damage, or nonspecific interstitial pneumonia. Understanding the specific pattern can sometimes provide clues about the offending drug and the potential prognosis. A scene shows images of potential treatment options, such as oxygen therapy, corticosteroids, and other immunosuppressants. A treatment and management of DILD primarily focuses on stopping the offending medication. Early identification and discontinuation of the drug are crucial for improving outcomes. Supportive care, such as oxygen therapy, may be necessary to alleviate shortness of breath and improve oxygen levels. In some cases, corticosteroids or other immunosuppressant medications may be used to reduce inflammation and slow the progression of fibrosis. Pulmonary rehabilitation, a program that includes exercise, education, and support, can help improve lung function and quality of life. In severe cases, lung transplantation may be considered. A scene illustrates the importance of medication monitoring and communication with healthcare providers. Preventing DILD involves careful consideration of the potential risks and benefits of medications. Physicians should be aware of the drugs that are known to cause lung damage and closely monitor patients who are taking these medications. Patients should also be educated about the potential symptoms of DILD and encouraged to report any new or worsening respiratory symptoms to their healthcare providers promptly. Regular lung function testing may be recommended for patients at high risk. Assini concludes with an optimistic image of someone engaging in activities, emphasizing the importance of ongoing research and hope for improved outcomes. A prognosis of DILD varies depending on several factors, including the specific drug involved, the severity of lung damage, and the patient's overall health. Early diagnosis and prompt discontinuation of the offending medication are associated with better outcomes. While some patients may experience complete recovery, others may have persistent lung damage and ongoing respiratory symptoms. Research is ongoing to better understand the mechanisms of DILD and to develop new and more effective treatments. These include studies investigating the use of antifibrotic agents and other novel therapies. By raising awareness, promoting early detection, and advancing research, we can strive to improve the lives of those affected by drug-induced interstitial lung disease.